Check this out. Come on. Come on. Come on. Good morning, YouTubers. About 44 degrees outside. Gonna go for a little run. In the military, got a couple weeks left. Going through a med board process. A couple things I thought were interesting or didn't go the way I thought they would is the percentages you get from the VA in the Army. So I ended up breaking my back. I have high flexibility. I don't really care what your pain is, and I probably could have milked it more, but that's just not my style. During the test, I'm able to bend over. I mean, I could tie my shoes, and I'm sure most people can, but they just, you know, bend over a little bit, like, oh, it hurts, and then they get a higher percentage. I have a spondylolisthesis. I don't know if I'm pronouncing that right. Spondy, grade 2. One doctor says like a 2.7. So my spine is almost halfway off, and I got 10% for it, and I was like, man, 10% for a broken back? Not cool. I was a little disappointed with that percentage. Overall, it was like 50%. They do their VA wizardry math, and I'm with a total of 40% disability. I'm okay with 40%, you know, I'm still very capable. I had this, one doctor told me motion is lotion, so as long as I keep moving, it doesn't hurt as much. I'll kind of be dancing around all the time, or just constantly kind of moving. Standing in formations was terrible for me. I don't know, sometimes I'd be like, after 5-10 minutes, I'd be like, oh man, holy cow, man, get this over with. I'm dying here. And some of these formations would last like an hour. I'm just standing there locked up, and I'm like, man, I need to move. I took a nasty fall in Iraq, started bumping the nerve. I don't want to end up in a wheelchair or lose bladder control or, you know, have those problems. I decided to start pushing the med board process. There are also many other things that I reported. The thing that got me not getting a percentage on those things is I never went to the hospital. I never went to the clinic and was like, hey man, I'm having trouble picking up stuff with my left hand, or I got these tendon aches in my elbows, you know, whatever my issue was, because it usually took me like 5 issues before I go see the clinic, and they're like, oh well, we can only talk about one of your problems. So I'm like, okay, my back's the worst one, you know, it's broken. Let's deal with that one. Where any other issues I might have had, I just swept aside, and it took a collective amount for me to be like, okay, I'm dying, I can't move, for me to go in and get help. It doesn't always pay to be a tough guy in the Army. If you are hurting, you know, get that documentation down. There's got to be a better system, you know, to take care of us, because in one aspect you're kind of a dirtbag for going to the clinic, in another aspect you're like, man, I need to take care of myself. And maybe because I joined at 35 and kind of have that entrepreneur background, if I can beat these 20-year-olds, man, I ate it up. I loved it. I took pride in that, so that kind of fed me, and I pushed myself. So if you're going through the med board process, you're just in the Army and you're like, hey, I got some aches and pains, you know, once a month, take the time to go get some stuff documented and checked out. When you do get out, you have some documentation on it. I think once a month might be balanced enough for some of you guys that are pushing things hard. 10% for a broken back, I was like, man, that's terrible, that's not right. But overall, 40%, I could live with that. If I end up in a wheelchair or something, then we can work on upping some of those percentages. And on the flip side, there's some guys that just milk it. You know, every ache and pain, they go to the clinic and get all this stuff documented, so when they get out, they get this 80-90%. It's unbelievable to me. You know, you're like, man, you're like 22 years old, and when no one's looking, you're just fine. It goes both ways for milking it, and I'm not here to teach you how to milk the system. I'm just saying that if you legitimately have a problem, you know, take the time and go get it checked out. Back issues and so forth, you know, they're basing off a range of motion. And I was told that, but I'm not gonna lie, I gotta tie my shoes in the morning, and if it hurts, it hurts. Again, I'm a little crazy. I'm gonna go for a run. Whew. I'm gonna walk for a minute. Back's a little stiff. Gotta loosen it up for a second before I fall out or something on my run. Whew. Let's get going. Oh, I just finished my run. The first mile was brutal. It took me a while to loosen up, but once I got past it, the pain kind of found a natural pace, stopped aching, and I was able to keep going. I don't take pain medication. I think just because I naturally push things, I need that pain to tell me where my limit is. Otherwise, I would just push and push. If I do take pain meds, I'm like, oh, I can do this again, I can do that again, and with my injury, I got to calm down a little bit. I'll walk 12 miles on a broken leg. I'm just crazy like that. So I need that pain. I'm doing pretty good. If I could run 2.5 miles with broken back and push through it, then I'm doing good. It's healed in its spot. I got a few bone spurs. Another frustration I've had is every doctor that I see has a different opinion. One doctor will be, hey, you need surgery. This isn't a joke, you know, and I'm getting yelled at for doing burpees. Another doctor will be like, oh, you're fine, just walk it off. Another doctor's like, you know what? The spine is really, really strong. You know, just because some linkage broke, it should hold into place for many years. Surgery is only like 20% chance you'll feel less pain. You know, one doctor's like, oh, you just have arthritis. That one cracked me up, and maybe there is some arthritic pain in there, but I was like, can you pull my x-ray, man? You know, because I'm like, I'm telling you, it's broken. And he pulls it up, and he backtracked a little bit, but I think there's so many soldiers going in there for whatever reason to the clinics that used to a bunch of people exaggerating or lying about things. And